how many people are going to be in the room when you birth your baby? So this depends on how you birth your baby and where you birth your baby. So if we take a free birth, for example, which is where you have no medical professionals at all, then the woman only chooses who's around her, for example. If we think about a planned home birth with a midwife, whether that's independent midwifery or whether that's NHS midwifery, you'll have two midwives the whole way through. So you'll have one midwife who is providing that care, and then you'll have a support midwife to take over in case of any sort of emergencies, assistance, but also assisting with the birth as well. And yes, really important that women who have home births have safe care, so that's why they have two midwives that are sent out to them. In terms of a hospital birth, it depends on where you are birthing your baby. Very few units say that one midwife is sufficient. Most units will say that for the actual birth, so baby's head crowning, shoulders being born, placenta delivery, they tend to recommend that you will have about two people in the room with you. Now that's not always two midwives. Sometimes it can be your student, particularly if they're like a third year student who's qualifying very soon. Sometimes it's a maternity support or maternity care assistant that's your second person. So you've got your midwife who's provided care for you the whole way through labour. Ideally should be one-to-one the whole way through, and then you have a second person come in just for the birth of that baby. Now, absolutely, if there are students around, you want a student, then there might be one student, but there's never any more than one student in the room. The reason being, it's not really fair. Birth is not a spectator sport whatsoever, and it's really important to try and keep that bubble around the woman birthing as calm, as relaxing as possible, and having lots of people watching you just doesn't really fit well with oxytocin production, doesn't help with the physiology of labour and birth. And then if you have a Ventouse forceps caesarean birth, something unplanned that usually requires going to theatre, very occasionally they're done in the room, you will have yourself and your birthing partner. You will have an anaesthetist who provides the anaesthetic, an ODP or anaesthetic nurse, particularly for forceps and also caesarean births. You will then have two obstetricians or gynecologists, so one who's conducting the delivery in terms of forceps, Ventouse and a support as well, or in terms of the caesarean birth, both of them are performing the surgery. Then you'll have a maternity care assistant or support worker who enables lots of things to be grabbed if they need to. You'll have a scrub nurse. Now, again, forceps, Ventouse, if they think that the baby's going to come, then the scrub nurse will usually just wait outside the room and will only come in if they suddenly convert to a caesarean birth. You'll have a baby doctor, a paediatrician. You'll have your midwife, and or potentially a student midwife if they've been with you the whole way through, or potentially a medical student doctor, sometimes again working alongside the doctors who have been there. And yes, it is very busy. There are lots of people, but they all have different roles to play. It's all about teamwork. If you have twins, there are always twice the number of people as well, because you'll have twice the number of paediatricians. Sometimes you'll have an additional midwife to be able to support, because of course you've got two babies to take as well. So there's often more people in a twin birth compared to a singleton birth. Triplets and more, again, more people.